Hi, my name is Joy Moses, and I am in the Masters of Occupational Therapy program at the University of Alabama at Birmingham. The very first question you asked was, why did you decide to become an occupational therapist? And for me, at a very young age, I knew I wanted to help people, but I wasn't really sure how. In high school, I was able to present a project on occupational therapy where I had to research the origin of the profession, the job description, the amount of school you had to go to, and also the different settings. And that's what really piqued my interest, was that there was so many variety of settings that an occupational therapist could work in. So what I made sure of was to volunteer so that I can see which one of these settings really caught my eye. I was able to go to a pediatric outpatient clinic, hospitals, skilled nursing facility, just to see if this was the right fit for me. And it really solidified that this is something I could see myself doing for the rest of my life. I was able to see occupational therapists help all different types of people in different walks of life reach their goals and get back to their meaningful activities. And it was so rewarding to see how a person just coming in and coming up with interventions and spending that time to get to know you and see what you really wanted to accomplish could really give a person their quality of life back. The next question you asked was, why are you pursuing a fieldwork placement at Shepherd Center? As I mentioned before, I was able to volunteer, and one of those places that I volunteered was the Shepherd Center. I was able to see some of the amazing equipment, but also talk to some amazing occupational therapists. And I realized that these occupational therapists have the expertise in this profession, and I would like to learn and grow underneath these people who are the best of the best and know so much, because I want to be the best clinician I possibly can be. But also, coming back now that I have finished my coursework and coming to Shepherd Center with fresh pair of eyes, so then I can see the things that I've learned and how I can put my scope of practice and apply it to this setting. Next, you wanted us to choose a scenario. We have a client who's a 19-year-old male who has just been diagnosed with a C6 Asia A spinal cord injury, and they're a new client. And in the initial sessions, the client asks when they will regain use of their hands. So with the C6 Asia A injury, hand function does not usually present. Especially with it being Asia A, which is a complete injury, it's very unlikely that hand function will return to this client. Since they are new, I'm aware that we probably don't have much of rapport yet, but what I will do is talk to them about what they're able to do. So I would let them know that I can't tell them when they will regain hand function, but what we can work on today is using the function and ability that they do have, and through techniques and modifications and assistive technology, we will make sure they're able to do the activities that are meaningful to them and that they want to do and need to do to be as independent as possible. The next question that you asked was about receiving constructive feedback and how do I like my constructive feedback, and if I can give you guys an example of when constructive feedback helped improve my performance and my skills. I prefer immediate verbal feedback, so that way I can self-correct in the moment and make sure I'm not doing something wrong continuously throughout the day. But I understand that might not be able to happen every time feedback needs to be given to me. So I also appreciate written feedback. So if something comes up or I have a question about something that was previously discussed, I can refer back to my written feedback and see what things I needed to change and also what things I have done well. As far as a time when I got constructive feedback that helped me, would definitely be in the beginning of our coursework when we had our first lab practical, which we do with our professors. At the end, my professor told me that I needed to work on speaking to my clients in layman's terms, making sure that I simplify the information that I'm giving them so that they're not confused about what I'm trying to say. So when I took my next practical, I took that information and that constructive feedback and went in knowing that, making sure that I talk to them as simple as possible, but also keeping in mind not to be too simple to where it feels like I am not understanding that they do have an intelligent mind. And I think that's very important, is to not only talk in layman's terms, but to make sure you don't undershoot your client or make it seem like they don't understand what you're saying when they actually do. The next question that you asked was about working in a team to reach a common goal. And actually, we just took a course called I Can Do It, which is a program that works with young adults or children with disability, and you increase their physical activity and their healthy eating. I worked with a young woman who had Turner syndrome at the Horizon School, which is a transitional school between children with disabilities who graduate from high school and before they live independent adult lives. I was able to work in a team. It was 3 of us, a physical therapy student and a kinesiology undergraduate student. And we worked together to come up with different interventions and goals to increase our clients' physical activity. What really stuck with me was how we all had different information, we had different knowledge, and we were able to come together and work as a team to give our client the best care possible. And I still see the young lady at the gym to this day. It's very rewarding to know that we were able to leave a lasting effect on this young lady and change her behavior in a positive way while working together as a team. This would conclude my interview. I would like to just say thank you so much for this opportunity and thank you for your consideration and your time. Have a great day.